Having introduced you to stimulating herbs and the cold depressed tissue state in an earlier lecture, I'd like now to have a look at some specific herbs. First of all, we'll look at some aromatic stimulants. These tend to be warm to hot. They often have a relaxant, antispasmodic and carminative action, as well as being stimulant. They may be pungent or astringent or both. They often serve as adjuncts, catalysts and facilitating herbs to help with other herbs in the prescription. And they often have appreciable antiseptic, antimicrobial effects. So garlic's an obvious example, Allium sativum, pungent, hot and slightly sweet. Its principal actions are that it's immunostimulant, anti-infective for infections, especially in the respiratory, digestive and urinary system, and garlic can correct dysbiosis, as imbalance of gut bacteria or bacteria anywhere in the body. It's also an anticoagulator and vasodilator. It stimulates the blood circulation, reduces circulatory blockages, has anticoagulant effects, and it reduces blood lipids. The principal constituents are volatile oils containing sulfur compounds. In intact garlic bulbs, we have this molecular species called alliin. When you crush the bulb, an enzyme is released called alliinase, which takes two of these molecules and jams them together to form allicin, which is much more pungent and potent than alliin. Be cautious with garlic where there's digestive inflammation, and because it inhibits platelet aggregation, it could potentiate the blood thinning effects of warfarin and non-steroidal anti-inflammatory drugs. Another very hot stimulant would be horseradish, Armoraceae rusticana, of which we use the roots. It's quite dry in quality, quite bitter and astringent, as well as being hot. Principally acts on the circulation, the kidneys and the digestion. It's especially useful for cold depleted conditions and where there's a cold sluggish digestion. It's anticatarrhal and antiseptic in the respiratory system, and again there's sulfur in the principal constituents. These are mustard oil glycosides. Again, when you crush the horseradish, an enzyme is released, myrosinase, which transmogrifies cyanigrin, that's a technical term by the way, to allyl isothiocyanate, release with the release of glucose and sulfate ions. So don't use it, however, in gastrointestinal ulcers because of the corrosive effects, or in pregnancy if someone has a hot acute condition. And strangely, it's contraindicated where there's an underactive thyroid because it interferes with thyroid hormone production. And also be careful where there's a kidney inflammation. Much milder stimulants, cinnamon, still has hot and pungent qualities, but it's really only mildly dispersive. It's also dry, has a sweet taste, as you know, but is appreciably astringent. So the applications are mainly as a digestive stimulant, an antispasmodic, carminative and astringent. So where there's nausea, vomiting, diarrhea, colic, excess acidity, that's where you might use cinnamon. Quite useful for digestive infections. It's a gentle circulatory stimulant overall, so it has its place in treating hypertension and cold debilitating conditions. It's especially useful as a warming tonic for children where digestion and respiratory system are cold and inefficient. And often you see if you've got an inefficient digestion or you eat a lot of crap, then respiratory system problems will follow. So there's often that link. Constituents, principally cinnamaldehyde, which is a phenol propanoid. It's got this aromatic ring with an aldehyde component there, and tannins give it astringency. So probably don't use where there's hot inflamed conditions in your patient. Another pungent astringent remedy would be Medica cerifera, or wax myrtle. This is an old-fashioned physiomedical herb, but very useful. Forms one of the constituents in the legendary composition essence. So it's a diffusive circular stimulant, useful for cold conditions in general, but it's especially useful for congested upper respiratory problems and mucus congestion of the digestive system. Good for digestive ulcers, but also where there's menorrhagia and uterine prolapse. It's quite a tonic herb. So pelvic problems and upper respiratory problems. You can see this range of constituents, including resins and gums, which are quite stimulating, and it's probably best to keep the dose down. If you have more than 30 mils per week, it may well be emetic. Thuja occidentalis, sometimes called the tree of life, arbor vitae, principally using the tips of the branches, and this is a very common tree in the Pacific Northwest, in the temperate rainforests there. It's aromatic and bitter, quite stimulating, antiseptic, antifungal and anthelmintic. So you may have seen its use externally for fungal toe infections, but you can use it internally as well. And there's a bit of confusion about this because some people have noticed that this is quite a common homeopathic remedy, but that doesn't necessarily mean that it's poisonous. We'll get onto that later, but principal way in which I use it is for uterine prolapse, bladder weakness and uterine incontinence. It's a menagogue as well as being a uterine tonic, and it's appreciably alterative. So it, as well as toning up the organs, it will also sort of clear out blockages and congestion. And it's locally and systematically applied where there's overgrowth of fibroid cysts, and this is thought to be due to cytotoxic lignans which inhibit overgrowth. So one of the constituents is thujone, which immediately rings the alarm bells because it's a ketone volatile component. So avoid in pregnancy because of possible birth defects. And there you see the lignans and the tannins in there as well. Xanthoxylum, Clava herculis, percleash is a very useful stimulant. Sometimes you can spell it with a Z or a Z if you're American. Pungent diffusive effect, stimulates the circulation, useful for weak or obstructed peripheral circulation, cold hands and feet and that sort of thing. Most people think of it as an arterial stimulant, but it also improves the venous circulation where there's hemorrhoids or other varicose problems with the veins. It's appreciably anti-arthritic and anti-inflammatory, applicable in nerve damage, rheumatism and also toothache. One of its names is toothache tree. Useful also where there's abdominal distension and flatulence. So it contains alkaloids and coumarins, but also alkyl amides, which gives it that prickly taste, prickliness on the tongue. As far as I know, there's no cautions required with this herb, but you would keep the dose down. 10 mils a week is probably quite a hefty dose, and 5 mils might be more appropriate. Ginger is another very benign, I wouldn't say gentle, but benign stimulants, similar to cinnamon in a lot of ways. Not as dry as cinnamon, but still fairly dry. And there is a difference between the dry ginger and the fresh ginger in terms of application to dryness or moistness. with people. So if somebody's congested with fluid, then maybe better to use dry ginger. If somebody needs a bit of nourishment and fluid, then maybe use a fresh ginger. But in practice, you use what's to hand, don't you? So this is a diffusive circulatory stimulant, especially for the capillaries. So where there's poor peripheral circulation, and this is a classic adjunct herb to add to the prescription, as a kind of messenger herb to sort of take the other herbs to where they're needed. Appreciable anti-nausea effects give it application in travel sickness, pregnancy, and people dealing with chemotherapy. It can be used topically for sprains and arthritis as an anti-inflammatory. And the various complex volatile constituents, including gingerol, and the oleoresins are also really quite stimulating. So there's no general cautions. I mean, any stimulating herb, you just be a little bit cautious with the dose. Now we move on to sympathetic nerve stimulants. These have a direct action on the sympathetic neurons of the autonomic nervous system. These are really quite strong in action, quite symptomatic in effect, and you have to take care with the dosage. The first one we'll look at is cola species. The original Coca-Cola had this in. This circulatory stimulant, it increases sympathetic tone by increasing and potentiating adrenaline. So as application in asthma, overactivity of the gastrointestinal tract, fatigue and depression. It also increases cerebral activity, so it can stimulate your mind, and useful here for fatigue and depression. And you'll see that it contains caffeine and theobromine, so similar to coffee and chocolate in that sense. So don't give it if somebody's excitable or if they've got hypertension, probably not a good idea. A dosage range up to 2 meals 3 times a day. Ephedra sinica ma huang is a Schedule 20 herb, used to be Schedule 3, and this is a sympathomimetic antispasmodic. It works on the beta adrenoreceptors, so it dilates the bronchi in asthma and helps with their breathing. It's also a central nervous system and cardiac stimulant, so where there's poor circulatory response you might give ephedra. And in traditional Chinese medicine, if you have a cold or respiratory cold, and you get a white tongue, white snot, and shivery, so a cold reaction, so you're not getting a proper warmth response, you're not getting a proper fever, then ephedra is one of the heating herbs that you can use for that. It's also anti-allergic, a bit like having an adrenaline application, although it probably would not substitute for an EpiPen. If somebody has serious allergies, I wouldn't risk using ephedra instead of an EpiPen. So there's a long list of constituents. Dosage, memorise this: 48 mils a week, 2.4 mils in the single dose as the top range. Don't use it if there's hypertension, overactivity, hyperthyroidism, or glaucoma, and it also interacts with monoamine oxidase inhibitors. So that's the end of the show. Have a look at other stimulating herbs that you see in the literature and sort of reassess them in terms of applying to the cold, depressed tissue state. Thank you.